Hello, my practical people, and welcome back to another episode of The Practical Therapist. So, today's video is going to talk about autism and directional eye contact. When it comes to autism, one of the hallmarks or red flags that people immediately notice is the lack of social communication, and specifically things such as the lack of eye contact that children who have a diagnosis of autism or a suspected diagnosis of autism typically exhibit. Parents report to me a lot of times that, when they're trying to get their children's attention, the child will either look past them, look away, or turn their head away in an absolute refusal to try to make eye contact. So today's video is a short demonstration video of how you as a parent can try to elicit directional eye contact from your child if your child has a diagnosis of autism, or if you have a suspected diagnosis and you are in the process of getting your child tested. So I have some different items here that I'm going to show you, and then we're going to talk about what directional eye contact is, where that zone is, and how we can use different items to elicit that type of eye contact. So some of the items I'm going to share with you today are a ball, a container of bubbles, and a little noise maker, a little whistle. So first, you can purchase any of these items at your local dollar store or Walmart, or order them online. Now, when it comes to getting a child with an autism diagnosis to make eye contact, the first thing you want to do is survey your house and see if there's anything that would be of interest to your child, something other than maybe a phone or a tablet. So when I come into a home to do an evaluation, or if I do an evaluation via teletherapy, I have toys at my disposal in my testing kit. But if you're in the home, you may not have a whole array of toys available. So that's why, again, being the practical therapist, I try to find practical, cheap, accessible things that you as a parent can quickly get a hold of so that you can work on this with your child. So when it comes to directional eye contact, let's talk about the word direction. What you're trying to do is direct your child's eyes towards you so that they can cue into the social cues that you as a person, that we as people in general give to each other. Social cues could be anything such as smiles, any other facial expressions like a frown or a look of confusion or worry. So we tend to give off a lot of different emotions, and we also communicate using our face. So when it comes to directional eye contact, if someone is looking past you, they're not taking in the emotions and the communication that you're exhibiting on your face. What I often tell parents is that if you only hand items to your child and you don't really require that directional eye contact, your child is treating you like a vending machine. So let's talk about a vending machine and what that process looks like. You go to a vending machine, let's say you put in your money or you swipe your card, you pick your chips, your soda, or whatever you want. You punch in the numbers, you get your item, you grab it, and you go. Very limited interaction. So I've seen personally when children interact with their parents, it's the same thing. The child will go to the parent or take the parent's hand and place it on the item that they want. They will get what they need and they will go. So there's not much opportunity there for social exchange. So when it comes to trying to elicit that directional eye contact, what we want to do is take that child's attention from, let's say, the level of the chest here, which I would consider your vending machine, and bring it up here where all of the social cues are. So the directional zone for eye contact, how I would describe it, is going to be anywhere from around the chin area to your bottom lip to the brow here. This is the zone where you want your child to focus in on, where you can communicate through your facial cues information to them. So let's say you have a ball, not just any ball, but you may want to find a ball that has texture. I'm going to bring this ball in a little bit here so you can see that it has some spikes. And also when I bounce this ball or move it in any way, it lights up. So again, if this is something textural wise that the child may want to touch, or they may like to see the lights light up in the ball, you have something that now can garner your child's attention. So if the child reaches for the ball, if they just reach here or they just go to get it from your hand, again, they're treating you like a vending machine, and you've missed that opportunity to have directional eye contact. So in this instance, what I would tell you as the parent during a coaching session is bring the ball here. So if the child reaches to grab, you are having them look at you in this directional eye contact zone that we just talked about, where even if they're not looking directly in your eyes, they're looking in the direction. Again, that key word, they're looking in the direction of your eyesight, and then you can move your eyes to align with theirs to try to make eye contact. The goal here is not to try to maintain eye contact for 5 minutes, especially if your child is not doing it, but to get even a fleeting moment of eye contact, whether it's 1 second, 2 seconds, or 3 seconds. And then build upon that and hopefully get more consistent as you provide the child with more opportunities to do so. So this would be an example of the ball. You bring the ball to your directional zone for eye contact, and if the child reaches, then you can give them the ball. Here you go, here's the ball. So they're cueing into your face, they're listening to you name the item, and they're getting it from you. Next, we have bubbles. Same thing. You would want to blow the bubbles in the directional eye contact zone, like so. And you would want to also blow the bubbles in the direction of the child's face as well. Not to the point where bubbles are hitting them in the face, but to the point where the bubbles are floating in that zone. So not below them, not above them, but right there. And as you are blowing the bubbles, you can, again, label the bubbles, or the action that you would do with the bubbles. Pop, pop, pop. But again, the key would be to maintain the directional eye contact zone and keep the bubbles in that zone as you blow the bubbles. And lastly, we have a whistle or a noisemaker. So this item here is already going to help you get into that directional eye contact zone, because you have to put it in your mouth in order to make noise, in order to activate it. And also, I tend to try to find these little things from the dollar store here that are brightly colored and have little tassels. So even just the bright color and how it's designed can also be something that attracts the child as well. So again, with a whistle, you're already in your directional eye contact zone. Again, remember, from that lower lip to chin up to the brow area. And you're also making noise. So you're also using auditory cues to also get your child's attention. And we'll talk more about that in a later video. But as far as getting your child to attend to what you're doing, you would take the whistle, you would put it in your mouth and blow it. So again, guys, I hope you found this video helpful. Feel free to rewind it, go over it as many times as you need to. Make sure you like, share, and subscribe, and I'll see you guys in my next video.